We conduct our own self-sponsored research each year just to extend our knowledge and also to share with our clients. And this year we're focusing on the consumerization of healthcare and how it's affecting several related industries. And we're happy to be able to present this to you and glad that you could join us. We'll talk for about 30 minutes, try to keep it really focused, and then we'll have time for questions and answers at the end, as Brad said. And of course, we welcome you to reach out by email or phone. We're just going to really touch the tip of the iceberg in our research, and hope it's interesting to you. So I'll start off first, and then Leanne will jump in, and we'll tag team on this. So first, what do we mean by the consumerization of healthcare? And we're thinking of two things. One is cost shifting, and one is healthcare delivery. So as you likely know from being in the industry and from all of us being consumers, there are greater costs shifting to consumers, especially with high deductible health plans. And at the same time, there's more competition with signs that consumers are expecting more convenience and fewer barriers. So that's part of the cost shifting that's going on. And in terms of healthcare delivery, we're also seeing a lot of consumer-oriented companies that are looking to influence healthcare delivery, and they're often in the news. And some headlines can remind us of what's going on in the landscape. Apple came out with their health records that are trying to put health records in the hands of patients, make that more accessible. Fitbit is having an influence on consumers and their well-being and trying to transform healthcare. Back in 2017, not that long ago, consumer DNA testing really blew up. The 23andMe and Ancestry.com became so common, and that's changing healthcare. Just last year, Amazon, Berkshire, and JP Morgan teamed up to try to disrupt healthcare, trying to develop their own delivery models and see what kind of cost savings they might be able to bring to the table. Uber and Lyft are trying to bring medical ride sharing. For a while, they've been trying to do this to try to make healthcare more accessible. And there are generational changes going on with both millennial doctors and millennial patients shaping what healthcare expectations are. And then not too long ago, the latest Apple Watch came out with an ECG monitor in it, as well as fall detection. And that's really putting a medical device in the hands of so many more consumers who could potentially be monitoring their heart rhythms or falls. And it's interesting to try to understand what that impact might have on both physicians and consumers. And in some cases, there are some concerns that it could be a potential healthcare headache, and we try to jump into that a little bit. So for our research, we wanted to really try to explore the emerging state of healthcare consumerization. We wanted to focus on readiness among both primary care physicians and consumers, and look at their readiness for consumer health technologies, including wearables like Fitbit and Apple Watch, various apps, the consumer DNA tests, ride sharing, remote monitoring medical devices, and telemedicine. And we also, in our qualitative work, even asked about voice-activated devices like Alexa and what role that might be having. Secondly, we wanted to try to understand consumer and physician readiness for what we thought of as consumer-centric convenience initiatives. These are more around healthcare delivery, like patient portals, self-scheduling apps, new sites of care, and price transparency efforts. And around all of that, we wanted to try to understand demographic differences, particularly generational differences that could be influencing healthcare expectations, both among physicians and consumers. We tried to have an eye out for unmet needs with these consumer technologies and convenience initiatives. Where do physicians and consumers want help? Where are their gaps? And also, who do they see as thought leaders around consumer technologies and convenience initiatives? So now about our methodology, Leanne's going to jump in.
Sure. So for this, we used a two-phase approach, phase one being qualitative and phase two being quantitative. We often do multi-phase studies that involve both qual and quant, not always, but often. It's really the best of both worlds. In qual, we do discovery research, and it's a deep dive into the whys behind things, and then in the quant, we have a more robust sample, and we're able to quantify the attitudes and processes and practices. So for phase one here, we conducted 10 in-depth telephone interviews with PCPs and 10 IDIs with consumers And then in the phase 2 quant, we conducted 100 online surveys with PCPs and 300 online surveys with consumers. So for this presentation, we're focusing on the phase 2 quant. We did already present the qualitative findings, and we'd be happy to follow up if you're interested in any of those findings. It's important to note that the physician research here is limited to PCPs only, so the results may differ by specialist depending upon their subspecialty, but here it's PCPs only. So among the 100 PCPs, we did get a mix of subspecialty, health system affiliation, generation, geography, and gender. And then among the 300 consumers that we interviewed, we have a mix of type of insurance, generation, geography, gender, and ethnicity. And we did use a 10-minute online survey for this quant phase.
Yep. And one of the things, many companies do both qualitative and quantitative research, and at Zeldis, one of the things we think that's a little bit different is that we have the same team do the qualitative and quantitative, and that's what happened with this research, like is pretty typical for us, so that we carry the same learnings from the qualitative into the quantitative. So we had the same team, did the qualitative, did the quantitative, and we think that really adds some value in any research like this. I'm going to now jump into some of the detailed findings around the physician research, and then Leanne's going to take the consumer research. And we'll try to keep it moving for you. So again, this is focused on primary care physicians, not specialists, but we asked primary care physicians about their readiness to use different consumer technologies for their patients. We asked about their readiness to talk with patients about health apps, about Fitbit or Apple Watch, health data, about their readiness to have their office help patients with medical ride sharing. Would they make a phone call for them? Would they get involved at all? Their readiness to talk with their patients about 23andMe for medical screening. Their readiness to manage their patients using remote medical monitoring devices that send them clinical data. And their readiness to provide telemedicine. And this was, I think, surprising to us. Primary care physicians said that they do feel really ready to discuss health apps or wearables with their patients. I don't think that was too surprising in itself, that they were ready to have those kinds of discussions. I think what was a little surprising was what they said they're not yet ready to talk about. And we started to see a drop-off with medical ride sharing. A larger portion of primary care physicians are not ready to have their office help patients who need medical ride sharing. Even greater than that, we had a real drop-off in physician readiness, primary care physician readiness, to talk with patients about consumer DNA tests, things that consumers are doing very often. They're not ready, almost half are not ready to manage their patients with remote medical monitoring devices, and literally half say they're not yet ready to provide telemedicine, even though it's been around a fair amount of time. So that was a bit surprising to us. When we also looked at some generational comparisons in these data, we saw some interesting patterns. So really focusing on the health apps first, we see that, as you might expect, younger physicians, the millennial physicians, up to like age 37 or so when this research was conducted, they're much more ready for talking with patients about health apps and remote monitoring than their older counterparts are. And that really aligns with what patients' views are. Patients think that younger physicians are going to be more ready for these kinds of technologies. So we're seeing that there's going to be a change in readiness as a new cohort of physicians come into the marketplace, much more ready for these kinds of technologies. What is also interesting is what's not shown here, and that's that for some of the other consumer technologies, there is no generational shift. So millennial physicians are not more ready to discuss consumer DNA tests. They're just as stuck as all physicians are. They're also not more ready to provide telemedicine. So even though they're younger, they're coming into a different marketplace, they have the same gaps, the same unmet needs as Gen Xers and Boomers have. We asked primary care physicians which of these consumer-oriented health tools will have the most positive impact on their patient care over the next 5 years. And interestingly, they're most excited about the future of telemedicine. I think that was really surprising because it's the technology that they're least ready to provide now, and they think it is really the most promising over the next 5 years. They're also not ready for remote monitoring, and that's also pretty high up in terms of their readiness. Health apps, we see again that the younger physicians, they're more optimistic about health apps than the general physician pool is. They're much more optimistic about health apps helping their patients than Gen Xers or Boomers are. When we ask them, the PCPs, why are they optimistic about telemedicine? They said they're really excited because it offers more access in primary care, convenience, and better health. And by access, they mean for patients who are away at college or those with transportation challenges, like brand new moms when we talk to some OBGYNs, patients who are in rural areas who have to travel farther, or it means fewer barriers so that they can keep appointments and they can check in with them more often. They also point to greater convenience with telemedicine. PCPs appreciate that some patients don't want to drive or that sometimes they don't need a face-to-face visit for some conditions. And they also think that it'll contribute to better health. They see it as another tool to prevent ER visits, to try to prevent worsening health or decompensation, or even to get insights into how their patients are doing in their natural environment. For example, we had one pediatrician talk about the value of seeing kids in their home environment in some cases. So they're really excited about telemedicine, even though it's been around for a while. There's a big gap in their readiness for that. When we ask them the flip side, what are they most concerned about over the next 5 years, they're really concerned about the impact of consumer DNA tests more than anything else. About a quarter of PCPs cite that as having the most negative impact on their patient care. And interestingly, it's even the younger physicians, the millennials and the Gen Xers, are more concerned about those consumer DNA tests than boomer physicians are. There's almost 1 in 5 are concerned about telemedicine, and the reason there that they give us is if they are concerned about telemedicine, it's because they think it may provide lower quality of care, or they think it'll lead to overprescribing. So any programs around educating PCPs around telemedicine should certainly address quality of care standards and monitoring of that and overprescribing, the potential risk of overprescribing. The real concern about DNA tests is around lack of guidance. They're really worried about lack of guidance and good data quality. And the lack of guidance issue is just that they haven't been trained. Primary care physicians have not been trained to be genetic counselors. They don't know what to do with the information yet. They worry that it'll lead to wasted resources and over-testing because they don't know what to do just yet. Around data quality, their concern is that the data is not always accurate or that it's not comprehensive. So they're worried about their patients having a false sense of security, for example, not having enough mutations being tested in just a consumer test that may have fewer mutations tested than a different test than sort of a medically recommended test would have. So they're concerned about managing that information and having those discussions and also finding referrals to a genetic counselor. We also wanted to look at a potentially popular remote medical monitoring device, the Apple Watch with the ECG monitor, and try to get an early look at PCP's reactions to their role with this type of medical device in primary care. And we were surprised to see that the Apple Watch, the new one with the ECG monitor, really gets mixed reactions from primary care physicians. We saw that a third of PCPs say that it's both going to have both a positive and a negative impact on their practice. And if we split that out by generation, we really see that the youngest physicians, again, and this is counterintuitive to us at least, the Millennial and Gen X PCPs, they're more likely to have mixed reactions to the new Apple Watch than boomers are. They're more concerned about it. They're more likely to think it's going to have positive and negative reaction, a positive and negative impact than even boomer physicians are. The boomers are more likely to see it as a positive impact but it's the youngest physicians who are a bit concerned about what that watch will mean for their practice. And the reason is when we ask them about what's underlying these mixed reactions in our quant survey, it really centers on data accuracy and their hopes for better patient health. So the positive aspect is they really hope it can contribute to better patient health, but they're concerned about accuracy issues with the Apple Watch and the ECG monitor. They're concerned about both false positives and false negatives, and the stress that it may cause their patients and the workflow impact it may have on their practice. So they're concerned about patient anxiety, they're concerned about added office visits, they're concerned about over-testing, but they are hopeful that it can lead to catching some abnormalities that they might otherwise overlook. So again, their positive reactions really do focus on the hope for better patient health, that they can really diagnose some rhythm disturbances that patients can't detect and that they would otherwise not detect. Some primary care physicians also think it's better data, it's more data, it's better than what they have now, so they want that data. And I think one of the most important findings from the research is understanding where primary care physicians want guidance from health systems, from health insurers, from consultants, from anyone trying to speak to physicians. We asked them about 11 different consumer health tools that you see there in the table, and PCPs tell us that their top interest is in learning more about really the top 3 services there in primary care. They really want guidance. They want case studies on the use of remote medical devices in primary care. They want guidance on telemedicine, and they want guidance on patient health apps in primary care. Even though they say they're ready to have those discussions, they still want more information and more case studies. Not too far behind that is consumer DNA tests. They acknowledge there's a gap there. They would be open to guidance on consumer DNA tests. And then again, not too far behind that is patient cost information about prescription drugs. If they could do that easily, that would be of great value for primary care physicians. Switching it up a little bit, we also wanted to ask about the potential impact of Amazon on physician practices, as Amazon is another disruptor in healthcare and potentially another player in healthcare consumerism. So we asked here about the potential impact of Amazon on medical supply spend in primary care physician practices. And here we made sure the question was really about medical supplies. We asked them to exclude office supplies and prescription medicines and vaccines. And what we see is, currently, almost half of practices are not using Amazon at all to order their business supplies, their medical supplies. And in health systems, that's even more the case. 55% of health systems are not using Amazon to order medical supplies. Independent practices are a little more likely to be using Amazon currently. And the interesting thing is that we then asked them to think about the same question 5 years from now. Where do they think the trend is going? And 5 years from now, most primary care physicians expect their practices will be spending more of the medical supply budget with Amazon. That percent that says they're using 0%, that drops way down, and most practices expect they're going to be spending at least some of their medical supply budget with Amazon. And about a third are expecting to spend 10% or more with Amazon instead of traditional medical supply distributors. It's another interesting part of consumerism because here consumers are used to using Amazon in their home lives, and it probably makes it easier for physicians, office managers, just their practices to consider this option in their business life. So that's just the tip of the iceberg on our primary care physician findings, and I'll turn it over to Leanne now about the consumer questions.
Great, thanks. So we did ask consumers a similar set of questions as we did with the PCPs. So we asked about their interest in the consumer health technologies, using remote medical monitoring devices that would send clinical data to their physician, telemedicine, using consumer DNA tests for medical screening, talking with their physician about the health apps that they use, and talking with their physician about the health data from their Fitbit or Apple Watch, and again, using Lyft or Uber for medical appointments. And what we found is similar to the physicians. So most consumers, like the PCPs, are interested in remote medical monitoring devices and telemedicine for their health. About 2 in 3 consumers express some interest in these two health-related technologies. However, there is a split when we look at the consumer DNA tests, such as 23andMe, Ancestry.com, for medical screening, or talking with their physician about the health apps that they use, and again, talking with their physician about the health data from their Fitbit or Apple Watch. And this is pretty consistent with what we heard in the qualitative that we did. So consumers are using wearables, but there's a barrier when it comes to talking to their physicians about it. So the physicians say they're ready to talk with their patients about these apps and wearables, but the consumers feel that the physicians, aren't tech savvy, and they didn't necessarily think that much would come from having those conversations. This split is partly by generation we see here. So millennials are much more interested in consumer DNA tests, health apps, and sharing health data from their Fitbit or Apple Watch with their physicians, particularly when we compare that to the boomers. Millennials and Gen Xers are also more interested in telemedicine, but that's really directional, not statistically significant. So here we do have a larger generational sample size. So we have 100 in each generation for the consumers. We did find, and not terribly surprising, but those who currently own a Fitbit or Apple Watch are more interested in talking with their physician about the health apps or Fitbit Apple Watch data. But those folks are also more interested in telemedicine and remote monitoring medical device. When we look at the interest in using Uber or Lyft for medical appointments, we really see that the interest is lower here among the consumers. So nearly 6 in 10 are slightly or not at all interested in using ride sharing for their medical appointments. In terms of any subsegment that is more likely to be interested in ride sharing, we see a pop in urban and suburban residents over rural residents, perhaps because of availability of ride sharing. So interest in ride sharing is higher among those with Medicaid, so they may be more likely to have a transportation issue to begin with. And then again, millennials and Gen Xers, and likely because they're more used to ride sharing and they use it for other purposes. We don't see a difference between those who have and don't have chronic health conditions like asthma, diabetes, or arthritis, but we do see a difference when we split out the results by those who have and have not ever missed a medical appointment or not seen a doctor because of transportation. So we do see a big difference in interest in ride sharing here. So nearly 3 in 4 consumers who say that they've ever missed a medical appointment due to a transportation issue express interest in ride sharing, and that's compared to 38% of those who have never missed an appointment due to a transportation issue. So some interesting findings there. As with the PCPs, we asked the consumers to select the top 3 areas where they wish they had better information. So out of the list of the 11 consumer health tools here, we see that the top interest is in telemedicine, so how to use it, when to use it, if their insurance covers it. A patient cost estimator for medical procedures, so we see a pop here where that wasn't in the top 3 among the physicians. We do see a pop here among the consumers. And similar to the physicians, that remote medical monitoring device, so again, sending the physician the health data. Among the consumers, we also see that a third also want better information on consumer DNA tests. So we do see some similarities there. And this does not differ across the generations, so that the findings among the three generations does seem to be the same. We also asked consumers if they had information about their fitness in an app, so the number of steps they take, distance, calories burned. If they had that information, how comfortable would they be sharing it with their physician, health system, the company that makes the app, or with their health insurer to learn if they had these tool programs that might help them with their fitness goals? So this is interesting what we see here. So we found that many consumers would trust their physician and feel comfortable sharing this information with them, but there is definite reluctance to share this information with their health insurer. If you look at that bottom line of that chart, so only 41% are comfortable sharing their health app information with their health insurer. And we look at this by generation. We find that millennials are significantly more likely to say that they'd be more comfortable sharing this information about their fitness with the app maker rather than with their health insurer. So that's 62% when we look at the millennials, 62% compared to 46% who'd be comfortable sharing it with their health insurer. So that's a 16-point difference, pretty big difference there. So we asked those who said that they wouldn't feel comfortable sharing their fitness information with their health insurer, the reasons for this discomfort. And far and away we see that, and probably not surprising, but the concern is really around the fact that they think that they might see a rate increase if they were to share this information. But we also see that more than half also say they don't trust their health insurer, and that they're concerned that the insurer may actually drop them if they received this information. So that's interesting data there. So moving on, one view of healthcare consumerism is consumers doing price shopping when they can, and when they can is a big if. We asked if consumers are shopping around for prescription drugs, non-emergency medical procedures, diagnostic tests, and we see that very few are currently doing this. So that's the left side of the chart. So 15% say that they're currently shopping around for prescription drugs, 10% non-emergency medical procedures. But when we look at interest in doing so, we see a pop. So you know, more than half are interested in doing this, and so when we look at the generational breaks, there really isn't that much difference there. So the younger generations are the most likely to say that they would want to do this, particularly compared to the boomers. And we looked at that, the data by those who currently have a high deductible plan versus those who do not, and we thought that there might be some difference there, but we actually really didn't see any difference in terms of whether or not they had a high deductible plan. So we also asked about some agreement statements, and we saw some generational differences that we thought were interesting and that could affect consumers' expectations for healthcare interactions. So millennials and boomers are significantly more likely than Gen Xers to agree that childhood vaccines are safe. And we know that oftentimes we see in the news celebrities' opinions or the connection to autism, so that may be impacting some of the perceptions among the Gen Xers. And then we also see that millennials and Gen Xers, interestingly, are the most likely to question the need to get a flu shot. So only half of millennials and Gen Xers feel it is important to get a flu shot every year, and that compares to 2/3 of boomers. Millennials are the least likely to have a primary care doctor, which may actually make them more open to urgent care or telemedicine. And then we actually asked whether they'd be likely to choose a telemedicine visit over urgent care or a next day in-office visit. And So we do see here that millennials are the most likely generational group to say that they would choose telemedicine over going to urgent care or waiting the next day for an office visit. So we thought that was some interesting generational data there.
So, so we just wanted to summarize both our key takeaways from the physician research and the consumer research. And just to hit some of the highlights, what we thought was really striking about the primary care physician research is just to recap that nearly half of primary care physicians don't feel ready for telemedicine, consumer DNA tests, or remote medical monitoring devices. They do feel ready to talk with patients about health apps or wearables, and particularly millennial PCPs do. Of all the consumer health tools assessed, PCPs are really most excited about the future of telemedicine. Even though it's been around for a good amount of time, they are really looking for interest in, or they really have interest in guidance on how to work in primary care with telemedicine and how to work with remote medical monitoring devices. They're interested in workflow issues. How do you work with medical monitoring devices that are providing potentially constant health data or an overwhelming amount of health data? They want best practices. They want case studies on how to manage that. And they also want information about potential liability. At least those are some of the objections or concerns people have, and anybody in that space would want to be ready to handle those kinds of objections and provide case studies, best practice examples. PCPs are also most concerned about consumer DNA tests negatively impacting their practice. You're really worried about the lack of guidance on how to counsel patients and about inaccurate or incomplete data. Health systems, consultants can play a big role here in trying to meet that need for PCPs by, again, providing best practices, case studies, working on filling that information gap. Even it's just about referrals to genetic counselors or how different practices handle that issue. And as a new consumer health device, the Apple Watch, the newest Apple Watch, as we said, really garners mixed initial reactions from PCPs. They're really concerned about false positives, patient stress, and added office visits. And this consumer device really sets itself up as an early opportunity for health systems, medical device manufacturers to work with primary care physicians on how to handle the amount of data that's going to happen, how it may change patient needs and inflow into their practices. And they're looking for information on that. And lastly, 5 years from now, most PCPs are expecting they're going to be spending a greater share of the medical supply budget with Amazon. It remains to be seen if that will happen, but they are expecting that they're going to migrate their spend away from traditional medical supply distributors, I think because of their comfort with Amazon in their consumer life, and any medical supply distributors in that space will certainly want to do what they can to keep their customers loyal, and Amazon and companies like it will try to do what they can to disrupt it and understand primary care physicians and what their unmet needs are and what their perceptions are of the traditional model and the Amazon model. Around consumers, it's really striking that just like the primary care physicians, most consumers are really interested in telemedicine, even though some of the other technologies have a greater buzz, like ride sharing or Fitbits and Apple Watches. They're most interested in telemedicine, and they're really interested in remote medical monitoring devices if it can help their physician monitor their health. Interest is mixed for consumer DNA testing and talking with a physician about health apps, Fitbit or Apple Watch. You know, physicians say they're ready for this, and physicians in our qualitative said, oh yeah, I do this all the time. But when we, you know, it seems to us like that they do it a handful of times. It seems like to them like they're doing it all the time and they're ready to do it. But patients tell us in the qualitative and in the quant that they're much more reluctant to talk to their physicians. And the main barrier is their image of how tech-savvy their physicians are. And they think that younger physicians will be more tech-savvy. That seems to be true from the quant research, but that's definitely a barrier. We see that interest in medical ride-sharing is really high among consumers with transportation problems. And our quant survey it's only 1 in 7 who say they've missed a medical appointment or not seen a doctor, but that's still a substantial amount of patients in our survey and potentially out there in the real world. Among people who have missed a medical appointment because of transportation, there's a huge interest in medical ride sharing. And as Leanne noted, many consumers are still relatively reluctant to share their health app information with their health insurer, and unfortunately, millennials in particular are reluctant to share that information. And it's interesting looking at the relative trust they have for different sources, because they're more willing to share it with an app manufacturer than they are with the health insurance company that's paying their claims, trying to help them manage their physician network, and trying to help them stay healthy. Building that trust, building that expertise could go a long way. And lastly, when we talk about healthcare consumerism, part of the idea is that consumers will shop for healthcare. And right now, they're not shopping very much in terms of price for either prescriptions, diagnostics, or procedures, even when it's not an emergency. When we say, you have time to do this, it's not an emergency, we give them examples like LASIK surgery, for example, and they're not doing it, but they are very interested in doing it. And we had one primary care physician give us his perspective on this, and he said, whoever solves this nut first, whoever can get to price transparency quicker is really going to have huge inroads in the marketplace, that even this physician sees patients and physicians as really, really wanting price transparent information that they can share with each other. So it seems a long way off to us, but patients are very interested in not doing it so far at this point. So thank you on behalf of Leanne and myself and Zeldis Research and Schlesinger Group, who worked on this research together. We're happy to answer any questions now or offline. Our contact information is on this slide. We're happy to send the report to anyone else to speak to any other issues. Again, we just touched the tip of the iceberg in this short webinar.